Good morning, ladies and gentlemen. Welcome to another episode of The Athlete Unfiltered. My name is Thomas Kaufman and I am your host. Now, today we are going to be talking about low back pain in high school athletes, specifically acute low back pain. So, what are we going to talk about acute pain? We're going to talk about what to do at home, how to figure it out. Two, we're going to talk about when to seek out help from a professional, whether it's a sports chiro, sports physical therapist, or sports physician. And three, when you as an athlete need to take a step back from your sport and focus on your health. So, without further ado, let's go ahead and get started with the episode. So, when we're talking about acute pain is usually going to be any kind of pain that happened within the last 24 to 48 hours. Okay. This can come from a trauma. This can come from overuse. This can come from insidious, which is nobody really knows how it started. And usually, in athletes, that may be a big thing. Like nobody really knows how the back pain started. You just woke up one day and it was there. So, what are some things that you can do if you all of a sudden wake up with back pain and you don't know where it came from? Well, the first thing is don't panic. Do not panic about your back pain. There's usually an explanation for it. You just probably are not thinking about it. So, the best thing that you can do in those instances is okay, what did I do yesterday that might have aggravated my low back? And in some cases, you're not able to figure it out until you go see your chiropractor or your physical therapist and they start asking a bunch of questions and you start thinking about it. But if you're able to figure it out, then now you're going to have a better answer to those questions from your clinician when you get to meet them. Now, first things that you want to do at home is, well, again, not panic. Two, find movements or positions that do not aggravate your low back. In most instances, sitting on a couch and slouching is going to aggravate it. It's going to feel good because it's stretching most of the tissues, but the moment that you get up and those tissues contract again, comes back with a vengeance. Trust me, I've been there. Okay. So finding some of those comfortable positions, it's important. And one of the positions that we really enjoy and we tell about it to a lot of our patients is laying on your belly, getting on your elbows, propping up like if you're watching TV, again, if you're 5 years old again, and just relaxing the rest of your body. Relax your low back, relax your glutes, relax your hamstrings. All of that is going to be relaxed. Now you just take a couple of deep breaths into the belly and you just let them out. Go ahead, try it, right? I mean, go on, get on your belly right now and prop on your elbows. It's not weird if you're at the office, but that is one of the best positions right now that we have come across that helps probably 60 to 70% of our patients. Yes, there are patients of ours that, that doesn't do anything for them. And in those instances, we just work with them to figure out a couple of different movements or positions that are going to be less painful or are going to alleviate all of the symptoms so that they can continuously improve at home while they're recovering. Now, the other thing is you want to avoid, and yes, I'm telling you to avoid certain things because I don't want you to go and start saying, like, oh, well, I heard on this podcast that you can do whatever movement as long as it doesn't hurt. And it's true. But I want you to do more of the movements that make you feel good, that alleviate the pain, versus the movements that continuously aggravate the pain. So we're going to limit those movements. You're going to do them every so often to just kind of test yourself, but you're just going to go where you kind of kiss the pain, right? You give it a little peck. You don't have to make out with it. You just a little kiss on the cheek, and you're like, oh, it's still there. So those movements we're going to keep an eye on because those are the ones that are going to help us determine how well we are recovering, how well we are progressing through our rehabilitation. Now, so you got movements that make you feel good, movements that make you not feel good, right? And we're just going to kind of peck them on the cheek a little bit. And we're going to keep track and tabs on these movements. Now, you're going to do more of those that make you feel good, less of those that make you not feel good, make you feel bad, right? Aggravate the pain. Now, in my opinion, the moment that you start feeling some pain, you should start keeping a couple of tabs, like when did it happen and how long it's been going on. So If you've been with back pain and it's not because you worked out super, super hard a couple of days ago, or because you were in the wrestling mat and you got twisted wrong, you are I would recommend that you get a second opinion of what's going on in your back. So this is where you might want to call your local sports chiropractor, sports physical therapist, or even your sports physician, and try to get with them so that they can one assess your back and get you either in a rehabilitation program, a treatment program, or assure you that there is nothing wrong with your back and it's probably going to go away pretty soon. Now, if they reassure you, they should probably give you a couple of exercises, limitations, maybe a couple of like, don't do this, maybe do this throughout your rehabilitation so that one, you get better, two, you get back to your sport, and three, you don't just deteriorate by laying on your couch. Worst advice ever. Okay. Yes, there are times where you may not want to do anything, or they may tell you, like, avoid a couple of movements for the next day or two. Typically, that's if your pain is like a 10 out of 10. But for the most part, a lot of sports minded physicians and clinicians are going to try to get you back on your feet as soon as possible with proper movements, proper rehabilitation, and they should probably, uh, and they will most likely be guiding you through a lot of this rehabilitation, whether it's in person or via a program online. When you meet your physician, there's a couple of things that one you can ask them. Do you need imaging? That's typically the one that I get asked the most. Do I need to get an X-ray? And just like we talked on episode number dos, there's different answers to that. If the clinician is able to get a great picture of what might happen and um, an X-ray is warranted, they're probably going to get an X-ray. If they get a good picture of what happened and how you're presenting and your symptoms are matching what is in our head, we may not order an MRI for the first 1 or 2 weeks. We may just give you conservative care. So, it's going to be different depending on who you go to. An orthopedic surgeon might order an MRI right away. A chiropractor and a physical therapist may order X-rays first, right? It's going to depend, but you can always ask those questions. Okay, they should be able to give you an answer on why they are choosing to do imaging and why they're not. Now, once you are with your clinician, they're going to have certain recommendations, and these recommendations are typically going to be whether you should work out, whether you should avoid certain movements, whether you should avoid certain activities, whether you should do more of certain activities. Typically, these are all aimed and geared towards helping you as an athlete get back to your sport. Now, dependent on what injury you may have, right? If it's mostly muscle strain or joint compression, there's no fracture, there's no disc injury. Your rehab most likely is going to have a couple of different movements that are going to one either stretch the tissue, load the tissue, mobilize the joints, or they may be a little bit more severe, right? We can talk about that in a different episode. But for the most part, you want to get checked pretty, pretty, pretty close to your injury, right? I wouldn't say like immediately wake up with back pain and be like, oh my God, like I need to go to see the doctor. Give it a day or two. If the pain gets better, great. If the pain doesn't get better, okay. You know what? Like it's time to go see the doctor. It's time to make an appointment to see a specialist. Now, some people may disagree with that. Some people may say, hey, you know what? Give them a couple of days, give them like a week and see if it gets better. In my opinion, especially with athletes can go 2 to 3 weeks with pain before they even say anything. And then by the time they come into the office, we are 2 weeks behind a good rehabilitation schedule. And now we're eating into, districts, or we're eating into their new season. So the sooner you're able to get into a doctor or a clinician and figure out what's going on with your back, the better you're going to be and the faster you're going to be back in your sport or in your season. So With those recommendations, your clinician may say, hey, you know what? It's probably better for you to sit out the rest of the season, come back stronger next season. Now, there are different variants and variables here that may affect your decision. If you're a senior and you've been if you've got scouts coming out to see you, that's a big ask from your doctor, right? But his recommendation is not without risk, right? So he's recommending that you stay away or stay out of the season maybe a couple of weeks, in order for you to get better and come back stronger. But that may limit your play time in front of a scout. Now they may tell you, um, might be at the beginning of the season, you may be able to come back, or might be at the end of the season, and you may not be able to come back. There's a lot of different variables that you're going to have to take into consideration when you get those recommendations from your clinician. Now, your recommendations from the clinician are there to keep you safe, right? To get you back on track and to help you get better. Now, if you tell the clinician that you got scouts coming in to see you, you got people coming in to see you from out of state, and your college career is in the line, we have a heart. We're going to take that into consideration. But again, our recommendation is there to keep you safe. Now, you may also get recommendations that say, hey, you know what? I need you to sit out football if you want to wrestle. And if wrestling is the sport that you truly love, or track is the sport that you truly love, and it's coming up, in like 6 to 8 weeks, it might be a good idea for you to take a step back, sit out the football season, do your rehabilitation, get strong, come back conditioned, and come back more confident than when you got injured. So that when wrestling or track is here, you are performing at your best, not performing trying to recover from an injury that happened in a different season in a different sport. And that is sometimes what a lot of athletes in high school deal with. They get injured in football, but they really love wrestling and track, and they much rather leave the football field. And a lot of times, it's not the pressure of leaving the football field, it's the pressure of the coaches. So you as an athlete do have the say, and we want to empower you to have decisions in your careers. But you also have to remember that us as clinicians and your parents are here to, one, help you out and guide you the best of their abilities to be successful in whatever you want to do in life. If it's athletics, perfect, right? We want to keep you safe. As clinicians, we want to make sure that you get back to your sport stronger and faster, in better shape than you even came into our office. So keep that in mind, right? So what have we talked about today? Today we talked about low back pain in high school athletes. What to do at the beginning, right? Assess your condition, what happened. If you get a better history, a better idea of what might have happened, you can have a better idea of what to tell your clinician when you get to meet him, right? What movements you should be doing more often. So movements that make you feel good, you should probably do a little bit more often. Movements that make you feel bad, whether it's immediately or later, you should probably reduce a little bit of those for the time being. Introduce them sporadically, right? When should you seek out some professional advice or some professional guidance from a chiropractor, physical therapist, or sports physician? In my opinion, the sooner the better. 2 days, the same day that your back pain hurts, the day after you got injured, if you really know what happened. Some may disagree. I would much rather personally get myself checked out, make sure that there's nothing wrong with me. And, if they tell me, hey, your back's feeling pretty good, it looks good, nothing to worry about, perfect. What's my rehab like? All right, sweet, I'll do it. And finally, there are times that you as an athlete are going to have to take a step back from a sport that you enjoy in order to really perform in a sport that you love. And sometimes you're going to have to make those difficult calls on, I'm going to go against my doctor's recommendations, or I'm going to follow my doctor's recommendations and not finish this season. So I know there's a lot to unpack in this episode. So if you agree or disagree with any of my points, please feel free to send me a message at Dr. Dr. Thomas Kaufman, KFFMN. You can find me on Instagram or on Twitter and also on Threads. So if you disagree or agree with anything that I said today, leave me a comment. Let's argue online because, we can't have honest discussions in person anymore. Otherwise, have a great weekend. I will see you guys next Friday.